I think that everybody deserves adequate health care. It would save the country lots of money if we went in for well care versus waiting till we're really, really ill. An example is that my family has cancer in many, many generations in the women, okay? My mother, my grandmother, my great-grandmother, my sister, all my cousins and nieces have had cancer. For hysterectomies, I am the only one. So according to that, I think that well care is very important because I'm the only one that hasn't had cancer.
Wow.
Of all those generations of women. My parents live in Morton, Washington, and they will lose their home soon because their Medicare only covers a certain amount of their medications, and that ran out in March. So their medications cost more than they make a month. So it's not going to be too long when they're going to lose their home, and I don't know what we're going to do. I think that senior citizens having to divorce in order to get care or to lose their homes and everything they've worked for their whole lives just because of increasing health care costs, when that same medication that I bought for them in Mexico costs a tenth of what it costs for me to go purchase it here in the States, it's unheard of.
I saw a lot of healthcare issues, not only with the employees and the workers with their health care, but also with the residents that we work with. Their quality of care is not that good. They're waiting for this deficit to hit, and we've heard so many different things of them cutting Medicare, Medicaid, the residents not getting half the care that they should be getting because of that. So I'm here to learn more things about that and see what finds out. Also, some of the workers that we have there, we have a lot of single moms that work their tail off there. They might make a $800 paycheck within 2 weeks. Most of their children are not insured because it would take more than half of their paychecks. So to have a family of 3 or 4 live off $400 a month, you just can't do it. One of the senators, I talked to them and told them that in the facility where I worked, there was a couple that had been married for years and years. One was in an assisted living, the other one was at a long-term care facility where I worked. They had 15 kids there. They had accessed everything for the mother there to pay for her care. And so basically what ended up happening is they ended up having to divorce so the kids could have the farm that the state would have taken everything these people had worked so hard for.
Because I think Americans pay too much for health care insurance or don't have enough health care insurance. I myself pay about $650 a month for health care insurance. My yearly cost will be about $7,800 this year alone. Along with prescription coverage, it will be at about $11,000. And that's just for me and for my wife. More affordable health care for me and for my wife would mean a little bit more money coming home to help with my needs at home, rent, car payments, groceries, things like that. Maybe put something in savings and not have to worry about the high cost of my health care. Not having to worry about if I'm going to be able to go to work one day because I'm not feeling well. So yeah, affordable health care would help me out a lot.
I have the desire to see services for the families of veterans and for the families of people with developmental disabilities be made cradle to grave. Currently the system is way too disintegrated to make that happen. I see too many veterans families scratching for basic essential primary health care services. I have a special place in my life for adults with developmental disabilities. My domestic partner currently has no insurance. She is very good at getting her needs met through basic self-care, which mostly means nutrition and alternatives to the allopathic industry. But none of us are getting any younger, as they say, and quite frankly, I'm concerned that a major situation that happened to her would leave all of us in our household facing what we would have to sacrifice in order to stabilize her health.
I have health care through my work, but it's not enough. I try not to go to the doctors because I really can't afford to go to the doctors at all, and they do pay a little bit, but my bills are still high. So they would get excellent care because they will have the people there to take care of them. We won't be short of staff because staff will be getting the care that they need to get better. At this moment, my daughter, who has my first granddaughter, who's 4 months old, she doesn't have health care right now. We're lucky that the baby has health care, and they're wanting her to do basic, but she can't afford to pay, the basic health care fees and stuff. So.
Came to DC to talk to our senators and representative about health care, the changes that are going on right now, and hoping that they're going to go all the way and change the healthcare system so everyone can have health care.
And try and do my part to help push through healthcare reform for everybody.